Deadly clues that your body is hiding a blood clot. Imagine this. You're at your desk feeling fine when suddenly your leg starts to swell. What's going on? In today's video, we're tackling blood clots, those sneaky threats that can affect anyone at any time. I'll be sharing 7 prevention tips that could make a real difference in your health. As someone who's done extensive research on this topic, I can tell you it's crucial information that you won't want to miss. So grab your favorite healthy snack. I'm partial to carrot sticks myself, and let's dive into the world of blood clots together. Trust me, by the end of this video, you'll be a clot busting pro. Many of us think they're always obvious and painful, but the reality is far more subtle. Blood clots can be incredibly sneaky, and their warning signs are often easy to miss. Take my friend Rachel, for example. She's always been active and health conscious, but a few months ago, she started feeling a little off. Her leg was slightly swollen and felt heavier than usual. She dismissed it as muscle fatigue from a new workout routine. Weeks passed before the pain became unbearable, revealing a deep vein thrombosis. Rachel's experience isn't unique. In fact, a recent study in the Journal of Thrombosis and Hemostasis found that nearly 50% of people with blood clots initially dismissed their symptoms as something minor. The study highlighted some frequently overlooked indicators like mild swelling, a feeling of heaviness in the limbs, and unexpected fatigue. But it doesn't stop there. Blood clots can cause symptoms that seem completely unrelated. Some people experience unexplained coughing or shortness of breath, which they might attribute to allergies or a mild cold. Others might have a slight fever or feel lightheaded, assuming they're coming down with the flu. As your health advocate, I always encourage you to trust your instincts. If something feels off, even if it seems minor, it's worth getting checked out. Early detection can be a lifesaver. One blood clot symptom that's often mistaken for something harmless is a feeling of warmth in a specific area of your leg or your arm. Many people brush it off, but when combined with swelling or discoloration, it can be a red flag for a blood clot. Here's something that might surprise you. Blood clots don't just happen in your legs. They can form in various parts of your body, and the symptoms can vary drastically depending on the location. In our next segment, we'll explore these location-specific symptoms, showing you how blood clots can manifest differently throughout the body. It's crucial information that could help you spot potential issues early on. Blood clots can feel completely different depending on where they form in your body. It's like your body speaks a unique language for each location. Let's decode these warning signs together. Starting with the legs, deep vein thrombosis, or DVT, is the most common type of blood clot. You might notice swelling, pain, and tenderness in your leg. It's your body's way of waving a red flag. Moving up to the lungs, a pulmonary embolism can cause shortness of breath, racing heart, and sharp chest pain. Your body's basically yelling, hey, we've got a serious problem here. Now, let's talk about the brain. A clot here causes stroke with some pretty unusual symptoms. You might suddenly have trouble speaking or feel weakness on one side of your body. It's like your brain's sending out an SOS Morse code. Recent studies have shown that recognizing these location-specific symptoms is crucial for early detection. The New England Journal of Medicine published research highlighting how quickly identifying these unique patterns can lead to faster treatment and better outcomes. Here's a surprising fact. Blood clots can also form in your abdomen. These can cause severe stomach pain or bloody stools. Who knew your belly could be such a troublemaker? Understanding these symptoms is crucial for early detection and better outcomes. You're arming yourself with potentially life-saving information. Knowing the symptoms is just part of the puzzle. Let's explore risk factors that can make you more susceptible to these clots. All right, let's dive into the world of blood clot risk factors. And trust me, there are some surprises ahead. You might think that you know what puts you at risk, but prepare to have your assumptions challenged. When it comes to blood clots, we're dealing with a wide range of risk factors. Some are well known, like smoking or high blood pressure. Others, however, might catch you off guard. For example, certain medication used to manage excess bleeding could actually increase your risk of blood clots. Talk about irony. Recent research has shed some light on some unexpected risk factors. Genetics play a significant role, and so does something as simple as prolonged sitting. Yes, your office chair might be more dangerous than you realize. Dr. Heidi Moward, a neurologist, emphasizes the importance of both medical interventions and lifestyle changes in reducing clot risk. It's about finding the right balance between treatments and daily habits. Now, here's where things get really interesting. The real danger often comes when multiple risk factors start piling up. Picture this: you're overweight, you smoke, and you have a desk job. Each of these alone increase your risk, but together they create a perfect storm for blood clots. But wait, there's more. Remember that everyday activity I hinted at earlier? Well, here it is: long distance travel. Your dream vacation or business trip could be putting you at risk. When you're stuck in a plane or in a car for hours, blood can pool in your legs, increasing the chances of clot formation. Not exactly the souvenir you want to bring home. All right, it's time to gear up with some serious clot busting strategies. You know what they say, an ounce of prevention is worth a pound of cure. And when it comes to blood clots, that couldn't be more true. Preventing these sneaky little troublemakers is way easier than trying to deal with them once they've formed. A few simple changes can make a world of difference. Let's start with movement. Even just taking a quick walk every hour can help keep your blood flowing smoothly. One study found that simply flexing your calf muscles while sitting can significantly boost blood flow. It's like giving your legs a mini workout without even standing up. So how's that for multitasking? Now let's talk diet. Foods rich in omega-3 fatty acids like salmon and walnuts can help reduce inflammation and clot formation. Staying hydrated is crucial for maintaining healthy blood flow. For those of you who might be at higher risk, there are medical interventions available. Blood thinners can be effective, but they're not for everyone. Always consult with your healthcare provider before starting any new medication. Compression socks aren't just for long flights anymore. These snug-fitting socks can help improve circulation and reduce the risk of clots, especially if you spend a lot of time on your feet or sitting. Remember the dangers of sitting for long periods. Here's a simple yet powerful prevention technique. Set a timer. Every hour, get up and move around for just a few minutes. A lot of the smartwatches now have automatic timers that say it's time to get up and move. It's such a small change, but it can make a big difference. As we wrap up our clot-busting strategies, remember this: protecting yourself from blood clots isn't a one-time thing. It's an ongoing process, a journey of self-care and vigilance. But with these tools in your arsenal, you'll be well equipped to keep those sneaky clots at bay. Stay tuned, because our final segment, we're going to be tying everything together and giving you a clear action plan to keep your blood flowing smoothly for years to come. So in conclusion, let's talk about making blood clot awareness a part of our daily lives. It's time we take what we've learned and put it into action. This week, I challenge you to assess your personal risk factors and make some positive changes. Why not swap that extra screen time for a brisk walk and add some omega-3 rich foods to your meals? These small adjustments can have a big impact on your overall health. Remember, the power to protect your health is in your hands. With the knowledge you've gained today, you're already ahead in the prevention game. Keep moving, stay hydrated, and always listen to your body. You've got the tools to make a difference. Now let's use them. As always, I want to hear about your health journey in the comments below. Until next time, live with vitality.